This week has seen a record number of visitors to the federal website healthcare.gov. Many were rushing to beat the deadline to sign up for insurance that takes effect January 1st. But even those who managed to enroll are still unsure if they'll be covered. Wyatt Andrews takes a look.
There's the policy number and then there's a member ID.
The administration always predicted people would shop for insurance at the last minute, and that's what's happened in state after state. In Washington state, of the 65,000 people who've bought private insurance through Obamacare so far, 20,000 enrolled last weekend. In Kentucky, enrollments rose by 5,000 in the last week. Connecticut enrolled 6,700 on Monday alone. And in California, an unprecedented 100,000 customers have signed up since Friday.
There was a huge surge.
Peter Lee is the executive director of Covered California, the state-run healthcare marketplace.
We think the fact that in 4 days we had over 100,000 people enroll, as many as enrolled in 2 months, shows not just that people are getting the message, but that they're spreading the message. They're telling friends and family members, which I think is going to carry into January, February, and March.
The last-minute spike in enrollments now puts pressure on insurance companies to process hundreds of thousands of new customers in a short time.
I have a card that I can...
Karen Defnall, who runs a daycare in Central Virginia, says she thought she enrolled last week, but has no confirmation from her insurance plan. She's concerned she won't have proof of insurance when her coverage is supposed to begin next week.
And you're worried about what exactly?
What if a need comes up? What if January 2nd, I have an injury and I have to go to the hospital? They're going to ask for insurance verification, and I don't have anything to give them. Will I be denied coverage? Will I be denied access?
This surge of late signups is good for those patients who finally have insurance, but it's likely that the first few weeks of Obamacare will be confusing. Some patients who think they have insurance may not get their insurance cards on time, and Jim, still others will think they have insurance, but they've fallen through the cracks.
So, Wyatt, what are the insurance companies saying about this fear?
Jim, the important thing is to pay a premium. They're telling us that if you have a record of having tried to sign up and you pay a premium by January 10th, they will consider you covered going back to January 1st, and they tell us they'll just sort out what they owe the doctors and the hospitals then.
Wyatt Andrews in Washington, thank you.